My name is Barton. I'm one of the nurse practitioners here at Lakewood Family Medicine. I've been a family nurse practitioner for about 15 years now, much of that time here at Lakewood. I tend to use Isabel under a couple different scenarios. If a patient's coming back and the things that came to mind the first time and we kind of worked up didn't go anywhere. We still don't know what's going on. The patient's not getting better. Maybe they've got a few new concerns or complaints to add into the mix, but they're not clearly fitting into a common diagnostic profile. I'll use it to prompt a broader diagnosis list, the differential list, to see if there's something that I should include in that initial workup that maybe I wouldn't otherwise. There's a couple situations. There was one gentleman, he was in his 50s, fairly overweight, was coming in with what he was complaining of as left-sided chest pain. And he said it was just a deep, deep chest pain. The obvious diagnosis was to start with a cardiac workup, which we did, and the cardiac workup was negative. We just didn't come up with anything there. So then we treated it for musculoskeletal. I think at this point he has seen 2 or 3 different providers. I saw him after that original workup. Thought, wow, everything I would have done has already been done, and there's nothing there. You know, what else is there? And so we plugged all the information in to Isabel, and one of the things that came up in the differential diagnosis was a gastric tumor, stomach cancer, and that's what it ended up being. Nothing that, you know, I thought of. He wasn't complaining of any digestive symptoms, hadn't had a change in bowel, wasn't complaining of reflux or heartburn, the things that would lead you to think about a gastric cancer, but just had this deep pain that wasn't resolved with any of our other treatments. So that one is a very clear case that he had seen several different providers, had gone through a pretty extensive workup, and was almost told, you know, we just don't know. You know, it's probably musculoskeletal. Let's put you on more anti-inflammatories. But it was Isabel that said, you know, don't miss that gastric cancer. And it was. There was also a lymphoma case where a guy presented. This was one of the very first times we used it, and I think probably is what sold it to the practice. There was 2 physicians and myself. I was, again, the second or third person who had seen this patient. He was complaining of night sweats and diarrhea, weight loss, and we were getting distracted by the fact that he worked with a lot of chemicals, worked on a farm. You know, did he pick something up from some of the animals? You know, we were kind of chasing zebras, but plugged all the information in when the original workup was again negative, including his blood work was negative. And one of the things that came up was lymphoma. We thought, well, his blood work was good, you know, we're not seeing anything. And he was scheduled to get a CT scan. Isabel said, you know, make sure that CT scan is both chest and abdomen, and it wasn't. It was scheduled just for the abdomen. Called the hospital and said, hey, you know, I know you've got him on the table. I need you to add a chest CT. And they said, well, you know, we're already getting ready to scan. He had a negative chest x-ray. I said, no, you know, we need you to add that CT. And so they did. They backed him out. They scanned the chest and the abdomen, and we found the primary lymphoma in the chest. If we would have just done the abdomen, we wouldn't have found it. He's now status post chemo. He's doing great. For the ones you just don't want to call fibromyalgia, you don't want to call malinger, you know, chronic fatigue, you want to make sure you're not missing anything. You know, that's kind of the case that gets plugged in. When you pick up that cancer you would have missed, that changes someone's life.